Well, Alec, thanks very much for coming along to tell us a bit about your experience of living with a pacemaker and one of the complications that can sometimes happen after pacemaker implantation. Perhaps we could start from the beginning and you could tell me way back what it was that led to you having a pacemaker fitted in the first place.
From the early 60s to mid-60s, I experienced a series of faints, as it was described at that time. And our GP treated me with drugs and bits and pieces, and it wasn't until the 1970s, early 1970s, that they decided it was more than this. And I was sent to the Western General in Edinburgh for a tilt test. And from there, things went on quite quickly, and Dr. Boone recommended that I should have a pacemaker fitted.
So can you tell us a little bit about the fainting episodes themselves? What happened? What did it feel like?
A bit of warning, maybe 10 minutes warning, and a lightheadedness, normally after either physical exercise or if I was maybe trying to fight off some sort of infection.
Yes.
After that, it was just a matter of on the ground.
Yes.
And I was out for probably 2 or 3 minutes. But as things progressed over the years, the time that I was out seemed to be extended, according to my family. And it was at that point that our GP realised there was something more to it than just a normal faint. And that's when I was introduced to Dr. Boone. And after the tilt test, he recommended that I should have this pacemaker fitted, which completely changed my life, to be fair.
So what difference did that make then, having the pacemaker fitted?
I had no problems at all. It was like leading a normal life again. Although, to be fair, I'd accepted this because it happened so young. I was able to play football, run, play golf, cycle, all the things that I'd enjoyed when I was younger.
And back then, did that have an impact on driving, for example?
I couldn't drive for 3 months initially. And then I was given my licence back. I had to surrender my licence to DVLA. Given my licence back. And really that was it, back to normal life. And it was quite a change again to know that if I played badminton or five-a-side football or whatever, I didn't have the problem that if I went into the shower and came out, I wouldn't fall over. I was quite confident that everything would just be as it should be.
So your life was transformed by the pacemaker, and it stayed that way for quite a long time, didn't it?
It did. Best part, 20 years. Because it was quite early on when I had it fitted, 1997, 98. And then I had the third replacement in 2019. And within a few weeks, started to experience not quite, it wasn't fainting, but a weakness and progress to severe shaking and eventually to physical sickness. And these happened maybe every, I'm going to say maybe 3-4 months, but increased over a period of time over the last, I'm going to say, 2.5 years, till at one point I had 3 in the 1 week. At this point, we were still attending our GP in Port Seton. At this point, we decided that we had to progress a bit further with this, and you became involved in it at that point.
So just looking at these shaking episodes that you had after your pacemaker was most recently replaced in 2019, what did that feel like? Did it come on suddenly when it happened? And how long did the episodes tend to last?
I normally got something like 30 minutes warning. It started with, strangely, sore knees, sore shoulders, and freezing fingers. My fingers were frozen from there down, and they were pure white. The shaking would start, and laterally, physically sick, but never passed out. I was aware of everything that was happening round about, and I could speak. And it was just a strange, strange experience.
And then afterwards, how long would it take before you felt back to your baseline?
The turns, as I called them, lasted normally between 40-45 minutes. But it would take probably 2 to 3 days before I felt back to normal again, where I could play golf and do whatever I wanted to do. There was a weakness over that period of time.
And then you could go a few months before the next one would happen.
Well, initially,
at the start,
yes. No, initially, yes. But then laterally, and I'm going back to earlier this year, there was one period where we had 3 in 1 week.
Yes.
And that was quite debilitating, actually, where you weren't having a chance to recover between each period, you know.
So the effect was cumulative then? Yeah.
Yeah.
Okay.
Yeah.
And initially, when you consulted with me after the pacemaker was replaced and things didn't feel right, I was very focused on the settings of the pacemaker because the impression was that there was some overlap, at least, between the symptoms you were having then and the symptoms you had originally before the pacemaker was implanted, way back 25 years ago. But there were some differences as well, the shaking in particular.
That's right. I never experienced that before. But the recovery period was very similar.
Yes.
And that's why we thought there was some physical similarities with the illness.
Yes. And the pacemaker site itself, where the pacemaker had been replaced, did that look red, swollen, abnormal to you?
On 2 occasions we had small redness on it, and it looked like actually there was the remnants of maybe stitches that came out. There was 2 very small black, and it was like, I'm going to say like nylon almost that came through. But other than that, there was no pain, there was no soreness, there was nothing really.
Sure. And at the times that you came to my clinic and the wound was inspected, it looked like it had healed pretty well after the pacemaker replacement. Blood tests, which sometimes can be misleading, initially looked completely normal, and we do some blood tests to look for signs of infection, such as a CRP level or a white blood cell count, and all of these appeared normal until that rapid series of episodes that you had more recently. And what happened then when you had the 3 in a row?
Well, I think at that point, I came into the hospital and spoke to yourself, and there was a series of scans completed. And at that point, I think you realised that the issue was probably in the leads of the pacemaker, and that needed imminent attention.
Yes.
And you had me in within, I think, 4 days, if I remember correctly.
So your CRP level at that point rose from normal, which was less than 10 units, all the way up to around 130, if I recall correctly, at that time. But there was something else that convinced us, or convinced me, that an infection was there. And your wife was part of that, wasn't she?
She was.
An interesting story.
She knew that things weren't right. And she knew that my mental approach to the whole thing had changed. And she could see that I was under stress to try and convince her that my health was reasonable.
And then she got her phone out, didn't she?
Yes, she did.
And what did she do?
She took photographs, a video actually, which I think you were surprised at how fierce these actual shaking terms were. And I think she videoed me on 2 or 3 separate occasions, one unfortunately on the toilet, which I'm not too happy to let anyone see, but these are the way it is, you know.
But on the video, we could see that you were conscious.
Oh yes.
That your colour looked terrible. and that you were shaking
Uh-huh.
violently
Yeah.
and uncontrollably.
Yeah.
So you knew what was going on, but you had no voluntary control over
No.
what was happening.
No, I couldn't. Occasionally I'd say maybe a cup of tea will settle me down a little bit.
Yeah.
No way. It was over my shoulder. It was here, there, and everywhere. And that was, I think, when I realised that it was fairly serious.
Yes.
Up until that point, I just thought it was, part of being old.
And my difficulty at that point was that the pacemaker wound looked fine, and that on the echo scans you'd had done, we couldn't see any of these vegetations, which are usually the smoking gun for there being an infection on one of the leads. But that just reminds me, there was another part of the history that you told me in clinic that also convinced me that infection was at play here. We had your wife's video, we had the high CRP level, but I remember you told me that you had been treated with a course of antibiotics for a chest infection.
By their GP.
Yeah, what happened after that?
I had an issue which I thought was a common cold or something like that. Went to the GP, and he put me on a course of antibiotics. I couldn't tell you what it was, and within 2 or 3 days, I was back to what I would have called normal.
Yes.
That went on for maybe 2, maybe 3 months, and then the infection appeared to come back.
Yeah.
And I think that gave you some idea as to the
So
fact
unintentionally, your GP had temporarily suppressed what turned out to be a pacemaker infection.
Correct.
And that was the first time you said that you'd really felt well.
That's right.
Since the pacemaker was replaced. So what you thought was your normal baseline actually wasn't that good for you.
No.
With hindsight. Yeah. So then, moving forward, what we did was admitted you to hospital. We took lots of blood tests, and you ended up as an inpatient in Ward 103 here at Edinburgh Royal Infirmary for a month on antibiotics. And at that point, we knew that it may ultimately come to lead extraction, but also we didn't have hard evidence that the pacemaker was the source, even though with hindsight from the history, and with all of those symptoms stemming really straight after the generator replacement, that was a very likely diagnosis. So you went on to intravenous antibiotics in hospital for 4 weeks. How was that for you?
I found it difficult that we couldn't move, couldn't walk, couldn't get out of the hospital, basically, because I'm quite an active person. Other than that, I knew it was only for my own benefit. So I think, with the support of my family, who came in and out all the time, I think we handled it pretty well. But we're glad to get out at the end of the day.
And did you feel better?
Felt marginally better, yes.
Yeah.
But I knew it wasn't right.
Yes.
But put that down to the fact that there was so much medication in my body that maybe had some effect on me. Yeah. And to a degree it did.
Yeah.
A few weeks after I left the hospital, I was back playing golf, walking the dogs, gardening, doing what I would term normal functions, and hobbies. But about 2 months after that, one Sunday morning, I had another turn, and it was quite a serious one.
And of course, after that admission to hospital, you came to my clinic more or less on a weekly basis.
Yes.
And we monitored your blood tests. Everything had come back to normal. But what was curious during the early phase of that admission to hospital, you had spiked a CRP level up to 130, and with no treatment, it dropped back virtually to normal within a few days. Yeah. So this was quite an unusual behavior for a pacemaker infection, where the source of the infection, wherever it was, ended up releasing bacteria periodically into your bloodstream with quite long periods of in-between times when everything would look normal And you wouldn't feel perhaps 100% your normal self, and you knew that at the
Yeah.
time. But you were relatively okay, let's just say.
Yeah. And could lead almost a normal life in between
Yeah.
these periods.
Yes. And then, of course, as you've just described, you had another episode on the weekend, and then we realised, well, antibiotics alone haven't resolved this. For me, that convinced me the only place this infection can be coming from is the pacemaker. But what was interesting, just thinking about the whole psychology of what you went through, is that when we had that conversation, when you were readmitted to hospital, when it was clear that the infection had come back after initially trying antibiotics alone, was the sense almost of relief that we were going to do the lead extraction procedure.
This was the final decision, really,
Yeah.
as to finding a cure
Yeah.
for the I'm going to call it an illness.
Yeah.
And once we discussed it with the family, we accepted it, that this is how it was going to have to be.
Yeah.
And they were very supportive in that.
I had a sense that when we had elected to manage the infection conservatively at first,
Uh-huh.
and in my mind it was because there was some uncertainty about where that infection lay,
Yeah.
you had a feeling of it hanging over you. Is that fair to say?
To a degree, yes. But I had a feeling that this wasn't going to be a permanent cure.
Yes.
And I did ask, I think, at that point, whether there would be continual, maybe even oral antibiotics administered for however long it would be, if that was successful. Or I think when we made the decision that it was going to have to come out, that was it, the decision was made. That
Yeah.
was it, boof,
Yes.
you know?
You've been off antibiotics for how long now, Alec?
I would think it's probably best part 3 weeks.
Yep.
Between 2 and 3 weeks, yes.
And how do you feel?
I feel I'm getting stronger every day.
You were chopping wood, weren't you?
I was chopping wood. And hoping to get back to golf turn of the year probably,
Yeah.
which is only a couple of weeks away. Not even that.
Yeah.
Walking, not long walks, maybe a mile, something like that, out and back, and feeling pretty good.
Good. Well, Alec, thanks very much. It's
You're
been
welcome.
great to hear your story.
Welcome.
Thank you.